So OEIS stands for four separate birth defects that are complex, that they're all together. O is for omphalocele, E is for exstrophy, I is for imperfect anus, and S is for spinal defects. It's a condition that's really rare. About 1 in 400,000 are born with it each year, and they say that it is the most severe form of birth defects that is survivable, that you can live with. Each child who has it is totally unique. All different ones have different levels of the defects. And essentially, the best way to describe it is that everything from about the waist down when they were in the womb didn't form correctly. And so sometimes you'll have duplicate organs or organs that are split in half or organs that just didn't form at all. And so it's pretty complex in that there's just so many things that it involves. When I was pregnant with our daughter, I went in for a 15-week ultrasound, and we were actually hoping to find out if we were going to have yet another girl, because we have a lot of girls. And when they did the ultrasound, they looked and they couldn't really see what gender she was. They couldn't see what was going on, except that they said, well, it looks like her organs are on the outside, they're forming on the outside, and that her bladder seemed to be on the outside too. And so at that point they said, well, come back in 2 weeks and we'll have another look and see what's going on. So we still didn't know what we were having or anything. We just knew there was something wrong. So in 2 weeks we came back and they did another ultrasound, and this time when they looked, they said, yes, she has an omphalocele, her bladder is on the outside. It looks like most of her organs are forming on the outside, and she also has spinal defects. And because we still didn't know the gender, they said, we're recommending that you do an amnio to check to see if this pregnancy is even viable. And so I agreed to have the amnio done. They did the amnio, and talking with the doctor at that time, they kind of said, well, we'll see what the amnio says to see if we even want to continue with this pregnancy, because they really thought that I should terminate the pregnancy because she had so many things wrong with her. So we went back for the amnio results, and they said it's a girl and that all of her chromosomes were totally normal. So they didn't know what was causing this condition or to the extreme of what things were. In fact, at this point, they didn't even know that there was a condition of OEIS because they hadn't connected everything together yet. They just knew that she had these individual birth defects that were going on. And so we continued with the pregnancy, going in every 2 weeks for more ultrasounds, and it kind of got where I would go in and not ask questions anymore, because every time I went in they would say, oh, there's something else wrong, there's something else wrong. And so I would just go in and look at the pictures and not ask, well, what do you see this time? Because I was trying really hard just to enjoy being pregnant and not have to worry about what was happening with her. Our doctor at the time was a high-risk pregnancy specialist, and he told me that it would be a miracle if she survived until birth because she had so many defects going on. But I think we just surprised everyone, and at 34 weeks, I developed preeclampsia, which is pretty common for me. My other kids were all early because of that. And so I went in and they had to perform a C-section because of all these defects that they saw on her. And when she was born, she cried and she had good lungs on her and she looked good. And so they took her over to Primary Children's, and at that point they still weren't sure what condition she had. they knew that she had spinal defects and the omphalocele, but they weren't really sure still what was happening. And so it wasn't until she was 3 days old, they had to connect her bowels to the outside, because the imperforate anus means that her bowels don't come down all the way and connect. And so they had to connect her bowels with a colostomy. And when they did the colostomy, they went in and closed the omphalocele, the opening that was allowing all her organs to be on the outside. They went in to close that. And at that time, they also did exploratory surgery to see what else was going on inside of her. And that's when we got the diagnosis of the OEIS complex.